Good morning friends. Welcome back to my YouTube channel Medical Classes by Dr. Srimati Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. And as you know, we are discussing about different types of samskaras and continuing with the series of samskaras which is mentioned in Ayurvedic classics and also Hindu religious books. Today we will have one more very important samskara which is called as Karna vyadana samskara, or it is also called as Karna vyadana samskara. Now, the procedure of Karna vyadana samskara has got the scientific and as well as the religious importance in India. Okay, so this is practiced as one of the essential procedures in the infantile care in India. Okay, Karna vyadana samskara is performed to each and every kid, irrespective of the religion, with the different beliefs and also with the different understanding. Okay, so timings may differ in different parts of the country and also according to the different religions, but irrespective of all the religions, this samskara has been practiced by one or the other way. Anyway, so what is mentioned in the Ayurveda is it is rakshartham and abhushanartham. Karna vyadana samskara should be done for the two important purposes. One is raksha, another one is abhushanartham. Rakshartha means for the protection of the baby from different external hazards and also different external infections, etc. And abhushanartham means for the decoration purpose, okay, for wearing the different ornaments. So this is meantime it also fulfills the intention to decorate the baby by wearing the different ornaments. Now these are the references which is available in the classics. That is Raksha Bhushanam Nimittam Balasya Karnoho Vidyate. That is for the Raksha purpose and also for the Abhushana purpose. In case of infants, we have to go for Karna Vedana. Te Shashtavu Masi Sattame Vaha Shukla Pakshe Prashasteshu. So this should be done either in the 6th month or either in the 6th month during the time of Shukla Paksha Prashasteshu Titi Karana Mahurta Nakshatreshu, by looking at the good Titi Nakshatra, etc. Krita Mangala Swasti Vachanam, by doing some of the religious activities. Then Kumara At Angam Va Kumaram Upavesham Balak Kridanakehe Pralobhyaha Abhi Satvanyahan Bishagha Mahastehet Krishya Karna Devakrite Chidre. So these details are explained how this Karna Vedana Samskara should be performed and at what site it should be done, when it should be done, and what are the precautions that has to be taken, and what should be the position of the patient or the child, what should be the position of the physician who is doing the Karna Vedana Samskara. So everything has been explained in detail in our classics, especially Kashyap Samhita and Ashtanga Sangra explains in detail. So we will see that one by one. These are some of the classical references which is available, and this is also a classical reference. See, one of the Hindu religious books, that Parashara Grihya Sutra, it says that Karna Vedana Samskara should be done on the Tritiya month, Tritiya or Panchameva. Okay, so Sthanehe Vyadanam Rudiram Na Rugradika Ugragadi Sambhavam. So we will see all these things in detail. So as for the classics, the best time indicated for Karna Vedana Samskara is 6th month, 7th month and 8th month. That is according to Ashtanga Sangraha and also Kashyap Samhita. Whereas according to the Parashara, it is 3 to 5 years. Now, so as I mentioned earlier, the main intention is to provide the protection against the Graha Rogas. Okay, so this is very clearly told that Graha Rogas, therefore Rakshartham, and also for the decoration purpose. These are the two important purposes. Now here when I say Graha Rogas, so Karna Vedana Samskara will go into help to prevent the Graha Rogas. That suggests different types of infections. Okay, microorganism infections, different types of microorganism infection. It is quite useful. Another important intention is a decoration purpose. Now, in all the above mentioned month, maybe in the 6th, 7th or 8th month, so what we have to do is, on an auspicious day of Shukla Paksha, after performing the prayer, oblation, homa, bali, swasti vachana, mangala karma, etc., this procedure should be performed. Okay, now how this has to be performed? Child is made to sit comfortably on the thighs of the mother, okay, or the wet nurse. Then physician should hold the ear of the child, that is right ear in case of male child and left ear in case of female child, by the left hand. Okay, right for male, left for female. That has again got some of the religious aspects are there, traditional aspects are there. Okay, because whole Indian philosophy that attributes the right side to the male and left side for the female. Okay, the concept of ardhangini. Okay, so right side for the male and left side for the female. So that has been there in the classics itself. Okay, Indian philosophy from the beginning part itself explains this concept. We will see that in another class. Okay, physician should hold the ear of the child, that is right ear in case of the male child and left ear in case of the female child, by the left hand. Now meanwhile, by his right hand, physician's right hand, he has to pierce the ear lobule straightly through the Daivakrita chidra. Okay, in the ear lobule there is a chidra or a small hole is present, a natural hole is present, that is called as natural orifice in the ear lobule, and that is called as Daivakrita chidra, and through that Daivakrita chidra the physician has to pierce the needle. So Daivakrita chidra is nothing but it is a natural orifice, and how to identify this Daivakrita chidra in the ear lobule? It's very simple. A hole which is superficially covered by the thin skin layer, and by holding it in the direction of the sunlight, the rays pass through the hole with the trans-illuminating effect. This is how the classics say that how to identify the Daivakrita chidra. If you just stretch the ear lobule and hold that against the sunlight, then sun rays will pass through that natural orifice. Okay, this is actually there is an orifice which is covered superficial by the thin layer of the skin, so the sun rays will going to pass through it. This is something like trans-illumination effect. Okay, the light will going to pass, so that helps to identify the exact position of a Daivakrita chidra. Now this is where it is situated. This is actually situated in the center of the base of the ear. What classic says is Madhyatoho Karna Pitasya. This particular Daivakrita chidra is present Madhyato Karna Pitasya, that is in the middle or center of the Karna Pita, that is base of the ear. So therefore this is slightly towards the angle of the mandible, and this is covered by the siras. This is what classic says, that the exact area where we have to go into pierce should be Madhyato Karna Pitasya. Madhyato Karna Pitasya, it should be done. So where this Madhyato Karna Pitasya, that refers to the base of the ear. Base of the ear in the present day we usually say it is a mastoid part of the ear. Okay, so slightly towards the angle of the mandible, in the mastoid part of the ear, we have to go into pierce, and this is also having certain siras. There's a certain veins, certain nerves, etc. are present there. So we should be very careful. Okay, so now perfect pricking will not cause any problem or any pain and bleeding, etc. But imperfect piercing may lead to so many complications that we will see in the next class. Okay, so instrument used here for the piercing purpose is needle. In case of the thin skin, if the skin is very thin, then you can go for the needle, and it should be ara. In case of thick skin, ara refers to the needle of the shoemaker, what he used. Okay, so that is in case of thick skin. If it is thin skin, simple needle is sufficient. So in the right ear is first pierced for the boys, while for the female babies it is a left ear which has to be first pierced, and a mark has to be done by the red color ink or something like that. That is called as alaktaka. Okay, so after piercing that area you have to make a mark by using alaktaka. That is nothing but for the pointing purpose. Okay, for the identification purpose. So once you made the pierce, once you made the hole bigger by using the needle and all, then a cotton thread has to be pushed inside the hole after dipping it in the amataila. Okay, so you have to dip it in the amataila, then you have to pierce or insert a cotton thread to that hole, so that hole should not close again. Okay, so this thread is changed once in every 3 days. So later onwards this thread will be changed once in every 3 days. So now gradually increase the size of the cotton roll, or introduce the thick soft stick like stem of the leaves. So as the day passes, when the whole size goes on increasing, now gradually you have to replace the cotton thread by some other soft venules of the leaves or some other soft materials. Okay, so this helps in increasing the size of the hole. Okay, so this helps to increase the size of the hole, and the classic says that pichuvarti prayojayet. Okay, classics says the same thing as pichuvarti prayojayet. So this is how the Karna Vedana samskara has to be done. Now In the meantime, Abhyanga and Svedana should be performed regularly to the lobes. To these lobes again, Abhyanga and Svedana should be daily done. So they says that Bindyadya Vruddoho Strinantuhu. So on getting difficulties in Karna Vedana for the girls, Apanga of the ear can be pierced. So they says that suppose in case of girls, if they have got some problem in Karna Vedana, they are getting difficulty to pierce and produce a hole, then even Apanga portion of the ear can be also pierced. This is told by Ashtanga Sangraha. Okay. Cha apangehe bahyam vyapadaha. If there is complications arising or if it is difficult to do this piercing, then in case of the girls, you can also go for Apanga Pradesha. So this Apanga Pradesha probably refers to the ear lobule what we are doing nowadays. Okay, so end portion of the apanga is selected and externally invisible hole should be made in order to prevent certain disorders related to it. So Kashyapa advises certain medication to increase the Karna Pali. Suppose the ear lobule is very short or improperly formed or it is incomplete, aplasia etc. is there, then Kashyapa advises that certain medication to increase the Karna Pali can be given when it is very small or narrow, and later when the ear lobe grows to a normal size, the Karna Vedana procedure can be again done. Suppose if the ear lobule is not completely formed, now we cannot go for Karna Vedana there. There Kashyapa says first you increase the Karna lobe. Okay, increase the ear lobule by different Karnapali methods. Okay, and then once the ear lobule size come back to the normal size, then one day you can fix the Karna Vedana samskara. This is what Kashyapa says. So Karna Vedana samskara, he says that Rohini Swayam Gupta refers to Atma Gupta, Swayam Gupta Moolam Dve Haridre Brihati Faleher Brihati Fala Rase Grita Davet Pachet. So this is to increase the Karna Pali. Suppose the ear lobule is not properly formed, it is very small, it is very thin, suppose like that. Then to increase the Karna Pali, what you have to do is a ghee should be prepared. A ghee which is prepared by Rohini, Kapikachu Mula, 2 types of Haridras, and also Swarasa of Brihati Phala, which is added with Apamarga Churna, should be used for application. So this application over the ear lobule will increase the size of the ear lobule, and later you can go for Karna Vedana samskara. This is what Kashyapa says. Similarly, the bhasma which is prepared by Madhuchishta, Sarjarasa, Yava, Vaksaka, Eranda, by burning them inside the vessel, a bhasma is prepared, and then it can be also applied over the ear lobule area so that its size will going to increase. Similarly, the application of Gunjafala Churna or Musali Kanda mixed with the butter, Navanita, which is prepared by the buffalo's milk, Navanita of a buffalo's milk, can be also applied to increase the size of the Karnapali. Now, Karna Vedana samskara cannot be done in all the babies. Okay, so they says that, or in all situations, na ajirne, na malodreke, na atyushne api vardayet. During the ajirna or during the bowel disturbances, during the hot season, and as well as in the hot phase of the day, Ushnakala, okay, Karna Vedana is contraindicated. Okay, similarly, Kala Ushna Doshanaham Balanam Karna Vedehe Saha Gatra Vivardante Karna Palyaha Kani Cha Itihi Swasta Nirdosha Sharirasya Karna Vedam Kartavyaha. The child who is looking normal, looking healthy, nirdosha, there is no any doshas, shwarirasya Karna Vedam Kartavya. There only we have to go for Karna Vedana. So therefore again it suggests that samskara should not be done for all the babies. Samskara should be conducted only for the normal babies. Here also he says that Karna Vedana samskara should be only done in the normal, good looking, healthy babies. Okay, if the baby is having some problem, samskaras are not indicated. This is true for all the samskaras. Now, complications of asamyak Karna Vedana. Suppose if you do the complication Karna Vedana in an improper way, so what are all the complications which can arise? So that has been explained under the concept of asamyak Karna Vedana complications. Okay, so we will see that these are the references given from Sushruta and as well as yes, both the references are from the Sushruta. Okay, so tatra ajnanena yaduchayaha viddhastu siraju. Suppose if the person who is doing Karna Vedana samskara, physician, he is not a skillful person, he is not an expert person, there is every chance that he can go into damage the siras which is present in the Karnamula Pradesha. Okay, Sirajuhu, Kalika, Marmarika, Lohitaka. 3 important siras are present in the Karnamula Pradesha like Kalika, Marmarika, Lohitaka, etc. And by mistake, if it is get damaged, then there will be lot of complications. Okay, so that we will see. If injuries to the kalika takes place, then it leads to complications like jwara, daha, shwayatu and vedana. Okay. In case of injury to the marmarika, it leads to the problems like or complications like jwara, vedana, lymph node. Injury to marmarika, it leads to jwara, vedana, lymph node involvement like mandibular lymph nodes or cervical lymph nodes, etc. Whereas injury to lohitaka is more dangerous. If there is injury to lohitaka, it leads to some of the central nervous system disorders, complications like infections and meningeal irritation as mentioned below. Okay, see, a kalika and marmarika, so they will cause pain and inflammatory pathologies, then jwara, etc. and some sort of swelling, etc. Whereas injury to lohitaka, it is quite dangerous and it will going to cause central, that is, infection will going to spread to the central nervous system very directly. Okay, so this leads to some of the symptoms of meningeal irritations as mentioned below. What are they? Manyasthamba, neck stiffness will be there, and apatanaka, convulsive episodes may be there, or sirograha, that is headache due to increased intracranial pressure or some other problems. So that means direct central nervous system complications will be there by the injury to lohitaka. Okay, another important complication is Karna shula. Karna shula can also occur, pain in the ear, middle ear infections. Many times improperly done this Karna vedana may lead to middle ear infections. Okay, so there are also manyastamba, apatanaka, shirograha, Karna shula. So these are all the complications of a lohitaka sira. Okay, so we have 4 important complications of lohitaka sira abhigata. Okay, so they are manyastamba, apatanaka, shirograha and Karna shula. Okay, so these are all indicative of a central nervous system involvement. Another important complication is local spread of inflammation. Local spread of inflammation. Shonita bahuttvena vedanaaya cha anya deshiyaha vruddhimitihi janiyat nirupadratayaha tadvesha viddhamitihi. So we will see what is that local spread of the inflammation. The wound which is created by Karna vedana can lead to the inflammation of the local area with the pain if it is abnormally performed, like shotha and samramba. It is daha, shota, redness, etc. may be there because of inflammation of the local area if it is improperly done. Okay, so Karna vedana should be done with the blunt needle. Usually Karna vedana should be done by the blunt needle or the thick needle, unsterile needle or crooked needle, and bent needle may lead to above told complications. Karna vedana, if it is done by using a needle which is a blunt, which is very thick, which is very unsterile, crooked needles or bent needle, so then it may lead to improper piercing and that may lead to all these complications. If the swelling is there, pain is there, inflammation begins at the site, then the thread or whatever pierced in the hole should be immediately removed. Suppose after doing Karna vedana samskara, you have created the hole and you have put some cotton thread or something inside the hole so that it should not get collapsed to increase the size of the hole. Now suppose if the signs of inflammation starts, immediately you have to remove that particular thread or any other material which is kept there. Otherwise it will go into further increase the inflammation. So wound should be applied with the paste of yasti, erandamula, etc. Okay, the paste prepared by yasti madhu and erandamula should be prepared, or yasti, erandamula, then yava and kila, which is mixed with the ghee and also honey should be applied. Okay, so lepa should be continuously applied till the complete healing of the wound. So later in future date, ear can be pierced again. So with this we complete the first part of Swarna Prashana. In the next class again we will continue the further portions of Swarna Prashana. Thank you very much.